Fredda, welcome to Heart and Mind. We're really grateful and honored and very happy to have you join us today. Could you tell us a little about yourself?
Well, I'm really grateful and happy to be here, and I really thank you for the invitation. My name is Dr. Fredda Rosenbaum. I live in Florida. I am a holistic dentist. I've been a dentist since 1982, and I've been holistic since 1993. And I wanted to give you a little information about what it means to be a holistic dentist and how we differ from regular dentists. So holistic dentists feel that the mouth is actually part of the body, and it's been separated out as a specialty for many years. The medical world doesn't really pay attention to what's going inside there, and very often doesn't make any correlation between infections and diseases that might be happening in the mouth and what would be happening in the rest of the body. So the major differences for us is, so the mercury fillings that people have, those silver fillings that are called amalgams, are 50% mercury. Many people don't realize that. That's one of our major differences. We feel that they should be removed in a way that's safe, that they're not really healthy for you. I'll go into more detail on that in a little while. Another major difference is fluoride. We're not fans of fluoride, and I'll explain some of that as well. And another major difference for us is we will discuss nutrition with people. We will talk to them about supplementation and what's going to work in their mouth and what's not going to work in their mouth or help in their mouth. We discuss home care and how to take care of your teeth so that you can actually keep them for a lifetime, hopefully. We are not fans of root canals, which is very controversial because there are millions of them done every year around the world. And it's the only medical profession that believes that a dead thing can stay in your body. Everybody else, if you have an infected toe or an infected anything, it gets removed or resolved. It doesn't happen with dentistry and root canals in particular. So those are the basics of what I wanted to cover today, if we can. And with your permission, I would start with mercury, which is that was the first thing that led me into holistic dentistry. So many people don't realize that there is mercury in their restorations, in their fillings. People think that if they see metal in their mouth, it's got to be mercury. There are different kinds of metal in people's mouths. So there are crowns that have porcelain on the outside and metal underneath. Those are not mercury. But some of those crowns actually have mercury fillings underneath that the dentist didn't remove when they went to put a cover on the tooth to protect it. So they've got layers and layers of metal. But the fillings themselves that are very obvious are those amalgams that we see. They are not all mercury, but they are 50% mercury and would be well advised to call them mercury fillings because they're not silver. There's some silver in there, there's some gold in there, there's some palladium in there, there's tin in there, there's iron in there. Depending on who manufactured it and where it was made, it will determine what's the bulk of what's in there. And so if you have several of these in your mouth, you can imagine you have dissimilar metals in your mouth and an electrolytic solution, which is saliva, and you've created a battery in your mouth. So batteries with metal will rust and corrode, which is really what holds these fillings in place, is rust and corrosion. Pieces, the edges break off. Bacteria can get in there easily. And 95% of the time when I take these out, there is decay underneath them. They also expand and contract like any metal in a cold or environment. Hot and cold will expand and contract, and so teeth fracture easily when there are mercury fillings in there. Most dentists will take them out because they're ugly. And you're allowed to take them out because they're ugly. And now most dentists are putting in the white fillings because they're much more attractive looking. Mercury fillings are easy to put in. They are inexpensive to put in. Insurance companies will pay for them. They will not pay for white fillings on back teeth typically. And so the patient has to pay out of pocket. They're still being placed all over the world and all over the country. When we take them out, holistic dentists, our biggest concern is the vapors that the mercury releases. These vapors of mercury pass through our mucosa, they pass through our skin, they pass up into our sinuses, and they pass into the blood-brain barrier. There's a direct correlation between the amount of mercury in somebody's system with the number of fillings they have in their mouth. And for women who are becoming pregnant, They often come into my practice. They want their mercury fillings removed because they have read that if you take the umbilical cord from a woman who has mercury fillings after the child has been born, it is filled with mercury. Your body is really trying to eliminate it from your system, and it found a place to put it. Mercury gets very tightly bound to the body. It has a real, it's missing an electron, so it's very, very reactive, and is easily bound into liver, kidneys, brain, muscles. It's all over the body. And it doesn't show up in a blood test necessarily. These things, people end up with diagnosis after a time that they are told that they have heavy metal toxicity. You may have heard this. Mm-hmm. And very often it's exposure to these kinds of things that has precipitated that heavy metal toxicity. For many years, I would go to regular dental meetings with standard dentists, and they would find out via the grapevine from my assistants and my staff that I was a holistic dentist or a biological dentist, and they would sit there and look at me like I had 4 heads. And the only thing I would say to them typically was, well, even if it's not, if it's okay for your patients, how is it for you to be exposed to it on a daily basis for 20, 30, 40 years? And there'd be dead silence for the most part. And as the years went by, I'd get these phone calls from dentists who'd say, you know, I met you at a meeting and you seemed like you were pretty intelligent and responsible, and I've been diagnosed with heavy metal toxicity. I have neurological issues. I have trouble conceiving a child that is normal. I keep having teratomas. And so over the years, they become exposed to this stuff. Now, some people, everybody has a different immune system. Some people do great with whatever it is that's being thrown at them, and some people are very sensitive. So my patients tend to be people who are very aware of their medical issues. They're very aware of what's toxic and what's not toxic. And they're cautious about what's getting put into their mouth. So that's one of the things, if you were looking to find a new dentist, you would ask them, how do you feel about mercury fillings or amalgams? What would you do to remove them? So when we take them out, first of all, I wear a gas mask, which, I mean, between everything else that I'm wearing now, between the viruses, I wear 2 masks, a gas mask, a shield, a head covering, a full gown, booties, you name it, we're covered. And so is our patients. Our patients are covered. They are given oxygen to breathe so that they don't inhale all the vapors from the mercury that's being removed, from the filling that's being removed. They're given charcoal. We have special suctions in the office. One goes over the tooth. There's another suction that goes on top of their chest to pull out the vapors so it doesn't leach into their bodies as quickly as we would imagine it can be. And so we go through quite a protocol. I have special filters in the office that cause it to precipitate from the air. And there's a lot of precautions that are taken before, after, and during the amalgam removal in a patient's mouth. We're also strict about we don't cross the midlines. I've been taught that you can do the right side or the left side, but if you cross the midlines, patients tend to get sicker. The other thing we do is we give patients vitamin C, high doses of liposomal vitamin C, because it provides that extra electron to the mercury vapors, and it allows it to be passed out of the body if some gets absorbed, as opposed to being reattached into the body.
Now, Fredda, do you recommend, you mentioned the problems with pregnancy. I've heard that mercury fillings is often a cause of mental fog, of depression. Are there other symptoms that and ailments you have cited related to mercury fillings? And I wanted to ask you, do you recommend a heavy metal detox cleanse to people who've had them removed?
It's important to do some kind of a cleanse, because taking the fillings out is not sufficient. It is really tightly bound in the body and it needs to cleanse. And some of these cleanses can take a year or 2. And so very often, in order to determine if somebody has heavy metal toxicity or mercury toxicity, the blood test may or may not show it. Blood tests will show if it's very recent and very active. Otherwise, they have to give them a chelation agent, something that pulls the mercury out of their organs and allows it to be seen in the blood or urine or feces. Otherwise, it doesn't show up necessarily. But yes, it takes time for those things to come out again. So some of the people go for far infrared sauna. Some people go for IV chelation with vitamin C. You have to be cautious how you're removing the mercury. So there is something also, a heavy metal detox drink from Anthony William, yeah, the medical medium. He also gives a lovely drink that people can do on their own, which I'm glad that he created this for people. So chelation can be dangerous. Some of the chelation agents that they use actually would create a molecule, and when it attaches to the mercury in people's brains, it can't pass back out of the blood-brain barrier. So you have to be careful about who you're seeing and how you're doing it. Far infrared saunas are good because it comes out through the skin. You have to wipe off this when you're in the sauna. You wipe things off, keep yourself hydrated. Vitamin C is okay for most people, but it's a challenge to get it out. It can be a challenge. And hopefully, some people come into me and they get sick because their dentist took it out and they didn't take any precautions at all. They didn't know.
Oh my.
And I'm always sad to hear that. So yes, there are other symptoms besides depression. It binds to almost every enzyme in our body. It affects the bacteria, the microorganisms in our mouth, which is part of the digestive system, the very beginning of the digestive tract. And so how does it affect depression? How would you imagine that would happen? But they're finding now that the gut, we produce 95% of our serotonin, and a lot of our hormones that help with depression are produced in our gut. If we've now absorbed mercury into our system and shifted the microorganisms in our mouth, we're not functioning like we could be or ought to be. And so there's a lot of imbalances that can happen as a result of having the metals in our mouth. When I take this out of people's mouths, it now becomes a biohazardous waste. I am required by law to dispose of it in a very serious prescribed method. But in your mouth, it's okay. But once it comes out, it's not okay anymore.
And this seems to be related to fluoride. You were going to mention fluoride. I remember reading an article before that said fluoride was really a byproduct of the radiation industry or some way related to that. And they had a lot of it and they needed to find something to do with it. And there was some study that said none of the participants in the study had any cavities left. It failed to note that they didn't have any teeth left. The fluoride had made all of their teeth fall out. Could you mention fluoride? Because I certainly grew up in the generation that if your toothpaste didn't have fluoride in it, it wasn't really toothpaste.
So fluoride is very interesting. And yes, it was a byproduct of the aluminum industry. It was one of the pollutants. And these communities had high levels of fluoride in their water and noted that we don't have any cavities either. And so the community next to them said, well, we want fluoride. And then one next to them said, we want fluoride. We're the only civilized country in the world that fluoridates our water.
Wow.
It is a poison. It used to be used as a rat poison. It arrives in the toothpaste factories with a skull and crossbone on it. It is a poison. And at high enough levels, it is poisonous. There is a certain level where they say so we're allowed 2 parts per million in the water, but how much water do you drink? It's in our ice cubes. It's in everything that's been reconstituted. They've taken it out of baby formula because they realized it could be dangerous, but it's still very prevalent in everything. It's in wine, it's in grapes, it's in juice, it's in everything because we water our crops with the water and it's all fluoridated. So the amount of it is now very up for question. We don't know how much we're getting and how often we get it. We have no way to tell. So for me, toothpaste is not the big issue. It's our fluoridated water that I really find offensive. And if you think about it, it's like swallowing sunscreen. It might be great topically, but I don't need to drink it. Mm-hmm. We are the only country in the world that fluoridates our water. It has been shown to cause decrease in IQ in newborn babies. It has been shown to cause premature aging and joint issues. It looks denser on an X-ray. The bone that has been fluoridated will look denser and the teeth will look denser, but underneath they're brittle and break easily. So in communities where there's been fluoridated water, there are study after study in the New England Journal of Medicine about how the increase in hip fractures occur because the bones have become more brittle as a result of that. It's increased in cancer. Long bones of the body absorb it. It also interferes with iodine for the thyroid. So they're very similar compounds, iodine and fluoride, but it will replace the iodine in the thyroid and cause thyroid issues. So fluoride for me, and there were also communities in, I think it was Japan, we're also high fluoridation issues from pollution, really. And these people were crippled. They were just premature arthritis in their 20s and 30s, bent over, crumpled up. So it has issues. It is a poison, and we don't know how much we're getting anymore. And it became so popular that, you know, a lot of the dental companies started manufacturing products. It releases fluoride. It releases fluoride. And when you say to them, how much does it release for how long? We don't know. You contact the manufacturers. You say, how much does it release for how long? They can't tell you. And they started to put sealants on kids' teeth, and it releases fluoride. And I'm like, for how long? How much? How many sealants are you going to put in today? And then you wonder why the kids who have these fluoride treatments end up throwing up. But they throw up because they've been poisoned. They swallow too much of it. So toothpaste for kids, I would be very cautious about using fluoride. I don't. Some of my elderly people who have tendency towards root caries and really dry mouths and have a problem with that stuff, sometimes that's their best option because they live on candy bars because they can't taste anything else but sugar. As we age, we lose our ability to taste a wide variety of flavors, and sugar is one of the last ones that's left. And so some of my elderly live on candy, really, and sugar. They're going to have cavities all over. So that's my thought on fluoride. Not a big fan.
Can I ask you, this is one of my bonus questions for you, but can I ask you then, what do you brush your teeth with? What do you use to brush your teeth?
I use a toothpaste with no fluoride. But honestly, I'll talk to you about what's involved in brushing my teeth.
Okay.
Because it's not just brushing my teeth. So when I suggest to my patients that they floss, brush, and irrigate. So it's FBI, so that you have an order for the whole thing. So floss first, brush second, and irrigate with a water pick. And I suggest people do it twice a day. And I suggest they do it after breakfast and after dinner. The reason I've gotten to that point is most of my patients are really healthy and they eat really well and they still get cavities. And you're like, well, what's going on? And so you talk to them, a lot of them are on smoothies these days, and they'll have a banana smoothie and they'll put some dates in there, or they'll put some maple syrup in there, or they'll put something in there, and they leave for the day and they go out, and these things sit and nest around the necks of their teeth and cause decay. And they cause the kind of decay that's really tough to fill without putting a crown on it, because it's like wraps around the tooth, and you can't put a filling that goes around the tooth and between the teeth. You just can't do it. So you end up with crowns and expensive restorations. If they floss, what flossing does is it breaks up the bacterial colonies, because we all have bacteria in our mouth. It's normal. It's part of our digestive tract. You have to have bacteria in there. And there's a beautiful balance with healthy bacteria in the mouth when it's done, when it's maintained properly. When you floss, you break up the bacterial colonies that are very tenacious. They stick like glue onto teeth. And you can't brush them away. You just can't. So you break up the bacterial colonies, then you brush, and then you water pick. And the water pick takes away the biofilm that adheres to the teeth with such tenacity that it's the only way to get it all out of there. So all of us, floss, brush, irrigate, after breakfast, after a smoothie, after figs, dates, raisins. I mean, they're stick like glue to people. And all those protein bars that are out there now that are sweetened with figs, dates, and raisins, they're great for it. They're healthy. They look wonderful, but they cause damage to the teeth. And then the other thing people are hooked on is these lemon drink. They drink lemon every morning to alkalinize their system. And I understand the need to alkalinize our systems. I do. But it doesn't alkalinize in the mouth. It's acid in the mouth. It doesn't alkalinize until it hits lower down and combines with minerals. Otherwise, it's still acid. As is most sugar in the mouth is acid. Fruit in the mouth is acid. And so that acid invites a type of bacteria that's able to live in an acid environment. They can't all live there. So the pH of the mouth is something that we talk about and look at, because if your pH is out of balance in your mouth, you can't support the bacteria that are healthy in the mouth. You will support the other kind of bacteria that cause either decay or gum disease. We can talk about gum disease too.
Okay. I've heard that sea salt rinse or Himalayan pink salt and water, rinsing the mouth with that is alkaline. Any feelings on that?
You know, you have to be careful. Rinsing is one thing, but if you're brushing with it, it's very abrasive. So you will brush off the outer layer of enamel. The other thing people talk about is the oil pulling, which can be wonderful if you can tolerate it. They say that it takes 15 minutes for you to oil pull. I can't keep something in my mouth for 15 minutes without swallowing it or spitting it out. But does it change the environment for the bacteria? Yes, it will do that. And so what we're always trying to do is find some balance of information in there. When you talk about sea salt or Himalayan salt or whatever it is, one of the things that really works well for balancing bacteria in the mouth is baking soda and peroxide toothpaste rinsing. Mm. So you can make it yourself with baking soda and peroxide. You just have to make sure the baking soda is an aluminum based and the peroxide is food grade. And you make a little slurry out of it and you can make it fresh each time. And that will actually help guide the bacteria into a healthier place. That's typically for people who have really the tendency towards having gum disease. Very often they have no cavities in their mouth. It's a different bacteria that causes decay and a different environment and a different one that causes gum disease and gingivitis and periodontal disease. So baking soda and peroxide is not a bad choice. People make their own toothpastes in my practice as well. They use coconut oil as a base and they use essential oils in there. So some of them will put tea tree oil in, or they'll put clove oil in, or they'll put a combination of things in there. And that's part of what they will do for that.
I was going to ask you about that. I make one based on, I was inspired by Nadine Artemis, who wrote the book Holistic Dentistry. She has a company, Living Libations, and she has a product, Yogi tooth serum, which I really got into. And then I just started getting the oils and making my own version. It's in a coconut oil base. It's neem, clove, cardamom, cinnamon bark oil. Mm-hmm. I think that's it. I think
that's great stuff. It's great. Just I have to caution people because they will try to skip putting the oils into a carrier oil, and very often they will burn their gums. So when you're creating your own things, you have to be cautious of the combinations, because if you have too much oil in there, you will burn the tissue. So I've seen people who are trying to eliminate an infection that they knew they had in their mouth, and they have put tea tree oil, for example, or clove oil directly on the tissue, and there's a huge burn that takes a couple of weeks to go away. So they have to be cautious about making their own things, but that one sounds fabulous. It really does. It sounds lovely.
I think I found out the hard way what you're saying, how much coconut oil. It's actually a good amount of coconut oil it needs.
It's really a glob of coconut oil and a drop of the essential oil. It really has to be very diluted for it not to burn, because it will burn. It burns tissue terribly. The other thing to look at is, I know most of you are very healthy eaters and you have beautiful food that's grown locally and it's wonderful. Most people are deficient in vitamin D3. And that is important for the calcification of the teeth. And calcium is not going to cut it. But the D3 is really critical for most people. And the D3 is absorbed best when it's in the presence of K2. So those two combinations of D3 and K2 are what going to remineralize teeth and bones. And so for example, if I put an implant into somebody's mouth, I have opened up the tissue and made the space for the implant, and they're deficient in vitamin D3 before I realized that I needed to start asking and put them on this before surgery. It was like going into cardboard. It was that hollow and poorly formed. And so now for me, when I do surgeries, I ask my patients, and I provide it for them very often, to go on to D3 with K2. There's also zinc and magnesium are also important in that conjunction of materials that need to be functioning together in order to have a healthy situation. So those are all very important. But floss, brush, and irrigate will save your teeth for the rest of your life. It really makes an enormous difference for people. And once they get the hang of it, it's not a hard thing to do. It doesn't take a long time. There are water picks that are available that are, battery operated. You can take in the shower with you if you don't have a good space in the bathroom. But it makes a huge difference. You think you've done a good job of cleaning out the teeth, and then you water pick and you're like, really? There's more? There's stuff comes out. And even if it's not coming out, you're at least decreasing the pathogenic bacteria and the microorganisms that are in your mouth that might be causing the issues.
Wow.
Yeah.
So let's get back to thank you so much. That is a wealth of information right there. We're psyched. Let's get back to some of the other things you mentioned. Root canals. Root canals. Very divisive. I've gone to dentists that even used ozone and had some holistic leanings, and they were still
ozone.
Excellent. And they still were going with root canals, and that there was no alternative to root canals. So could you explain to us what are root canals and what are the dangers involved?
So when a tooth becomes irreversibly damaged, which can happen from trauma, it can happen from decay, it can happen from dentistry, it can happen from a variety of different things. But once the nerve and the blood supply is compromised to the tooth, and that can happen from underneath or it can happen from on top, there's no way to save the tooth anymore. Now, there are times when a tooth is on the verge and it's just inflamed, and I will do ozone injections to see if we can convert it back to a healthy situation. And I would say sometimes it works, sometimes it doesn't work. It depends on how soon I catch it and the healing potential of a person, because everybody has a healing potential that's different. So the nerve and the blood supply have been compromised to the tooth. The tooth has died or is in the process of dying. Some of them die and there's absolutely no pain. They just change color. People say, my tooth turned black. I don't know what happened. That's a dead tooth. Or they're in horrible, horrible pain. And these are the toothaches that are notorious for dentistry, that are just miserable. What they do is they open up the part of the tooth, they go through the enamel and the dentin of the tooth into the nerve chamber where the pulp, so teeth are alive. That's the thing that people don't realize. Teeth are living things, and they are supported by a blood supply and a nerve supply and the nutrients and the saliva. They are supported by all of those things. It's a live functioning situation. When we go to do a root canal, we devitalize the tooth if it hasn't been dead already. So they go into the center chamber, they remove whatever's left of the pulp, the decay, the bacteria, whatever's in there, and they fill it with something called gutta percha, and now it's a dead tooth in your mouth. However, in that central chamber, there are millions of spokes of little tubes that come off of there. So it's like the spokes on a wheel. There are millions of little channels in dentin where the nerves used to live that can't be cleaned out. It's not possible. So the ozone sometimes they say, well, this will disinfect the inside of the tooth better. And it probably does help. And some of them have lasers, and some of that does help. It's still a dead piece of you that lives in your body for the rest of your life. We are the only medical specialty that allows you to keep a dead piece. If your finger was infected, you wouldn't leave it there. If your ear was infected, you wouldn't leave it there. But there's no way to cure it with an antibiotic like you can do some other things. If you had gangrene in the bone, you wouldn't leave it there. So now you've got this dead tooth that you've root canal, which doesn't really hurt. It stops hurting and you think, yay, I'm all better. And so we routinely x-ray root canal teeth when you come in for a checkup. I would say maybe 50% of them show signs that there's an infection going on there. And how does it show up? It's either a shadow at the base of the root of the tooth, or the tooth itself has been starting to eat itself away. So you're missing the end of the root. Instead of seeing a smooth line at the bottom of the tooth, it's now ragged and you can't make it out. Your body's trying to get rid of it. And so the question becomes, what does your body think of this? Is this now a foreign body? Is it you that kind of looks like you, but it's not really me? What do I do with this? So the questions become, does it precipitate autoimmune diseases where your body has now created an antibody against your own tooth? And does it not recognize other tissues in your body as a result of this? We also think and know that they're never completely sterilized. There is no way for them to be sterilized. And so there's always bacteria that are leaching out of these things that you can't control and the body can't do anything with. It's also, there's a whole protocol and a list of acupuncture meridians that run through teeth. And now you've got a dead object on the acupuncture meridian. Does it cause issues in the other organs of the body? Probably. So we give people the acupuncture meridian chart. We say you have a root canal on this tooth. Let's say it's 19 or whatever tooth it happens to be. These are the things that might be affected by it. Do you think that might have an issue for you? So I've seen over the years where I'll take out a tooth that's a root canal tooth that's infected and doesn't belong in their mouth anymore. And part of that is the protocol for that is also that we clean the bone around that area. I ozonate it. We do all kinds of things to try and revitalize the area so it's no longer just a dead zone. And we've seen people resolve a lot of issues. Now, if you travel out of this country for, let's say you have a type of cancer that is not available to be treated in this country, and I have quite a few of those kinds of patients. So they go to Germany, they've gone to Switzerland, they've gone to Mexico, they've gone to different places. First thing they ask them to do is take out all the metal in their mouth and all the root canals in their mouth.
Amazing.
they don't feel that they can heal anything if they've got these root canals. I was so sad the other day. So this patient I've had for years and years, she's a lovely woman. She's from Brazil originally. Every one of her upper teeth is root canaled and crowned. She's got a stunning smile. She's beautiful. She came in the other day and she says, I have breast cancer. And I was so sorry to hear it. And she said to me, and I'm going to treat this holistically. And I thought, I'm going to print you a copy of your x-rays. You take this to whatever holistic doctor you're going to work with and see what they think of this. She has, besides the 12 on the top of her mouth, she's got another 5 on the bottom. And I thought, she can't even give her body a chance to heal holistically with this stuff going on in there. It is just a block on every meridian. And so there are holistic dentists. There's a wide range, just like you said. Some of them do root canals. Some of them will not keep you in their practice if you have a single root canal in their mouth. They're adamant about them being removed. I have to be careful how I speak to patients because I can lose my license for telling them that it causes health issues. So I don't tell people this. I say it is your decision. You have an infection on your root canal or you have an infected tooth. It is going to be your choice whether you want to keep this tooth or you want to remove this tooth. And you need to go do your research about it. Because in the state of Florida, I have associates who've lost their license. So I have to be very cautious how I speak to people. So most of my patients come in, they've already done their research. They know what they want to do. They've had issues. They have recurrent cancers. They have all kinds of diseases and things like that. Those are the people that tend to find holistic dentists, the people who are searching for a resolution to a health issue that's been a chronic problem for them. And so root canals are really a controversial thing. And it's not easy to get a tooth taken out. I had 3 root canals. I sat through 10 years of seminars. I finally said, get them out of my mouth. But it took me a long time to make that choice. It's not an easy decision. And when it's front teeth, it's even harder. So I listen to them. I understand. I empathize with the problem. And it's a problem. But for many years ago, it was not considered a safe thing to do. And so nowadays that we're fortunate that there are ways to replace these teeth without root canals, but everybody's got their own sense of what's appropriate and what's safe and what's healthy for them to do. But I don't think they're a good choice for people.
It brings up a good point. You mentioned acupuncture and the acupuncture meridians. Acupuncture in Western medicine has become taken a lot more seriously recently. It's even covered by some insurance policies. People like Deepak Chopra and Andrew Weil have helped push alternative medicine more into the mainstream. But it seems to me in dentistry seems a little bit behind. Mainstream dentistry seems a little bit behind in catching up with what are the actual healthy, holistic practices. It seems that there's a very old school guard block against these things being spoken, although clearly there's a wave moving in the right direction, yourself being a perfect example of that. What do you feel about the state of dentistry as a whole these days? And do you see it going in the right direction? And we're hoping.
I think patients are going in the right direction. And I think they drive that in another direction. Mercury's losing its fan base only because it's ugly. I'm not allowed to remove mercury fillings because they're unhealthy. But if I say that they're ugly, I'm allowed to do it.
Incredible.
And so it's still, I still run into dentists that think I'm crazy. I still run into that all the time and don't ask their patients. And I'm always surprised if my patients say to me, nobody's ever asked me that. They've never asked me, what am I eating? Am I a vegan? Am I a vegetarian? Am I eating smoothies every day? Nobody asks. This is what goes on in our mouth. We eat it every day. How can you not ask? How can you say my dentistry is going to be perfect for 10 years if you don't take care of it? You're not. It's not going to happen. And you're not going to recover from surgery if you're not eating enough protein. If you're a strict vegan and you're not digesting the protein that you think you're getting from nuts and legumes, you're not going to heal from surgery. And I have patients on these rash choices of, I'm just a fruitarian. I only eat fruit that falls off the tree. I'm not doing surgery on you. You're not going to heal. You don't have the amino acids in your system to repair the work we're going to do. So I have these conversations with people on a regular basis, but for some reason, the dentistry, a lot of the dentists are still mechanics. They're not physicians of the mouth. And I'm sad to say it, but I have yet to see the turnaround. And the only way I have that, I don't talk to enough regular dentists because it's just not fun for me. So I don't talk to a lot of regular dentists. But I get the feedback from my patients who say to me, thank you for not thinking I'm out of my mind. Thank you for not thinking I'm crazy, that I have sores in my mouth all the time. And I think I'm allergic to my dentistry. And I say, you are. You're allergic to your dentistry. We need to change. You're allergic to the metal in your crowns. It's not okay for you. So it's still a challenging world, but it's way better than it was when I started this in 93. It's a much more conscious environment now than it was back then.
That's good to hear. That's fantastic news. So FBI, flossing, brushing, irrigation. Anything else? You mentioned what supplements support the health of the teeth, and perhaps diet. Is there anything else you could share with us in that area?
So I just want to go back on pH in terms of the mouth and saliva. So saliva is really an amazing thing that actually neutralizes acids and revitalizes teeth, remineralizes teeth. But if we're eating constantly or we're noshing all day long, it never has a chance to do its work. So we need to take a break between snacks of about 2 hours to let the teeth remineralize themselves. So for example, I had a woman come in, she's got 5 children, they've all got cavities. And I said, what are they doing all day? She says, they're eating fruit all day long. It's so healthy, it's wonderful. I leave bowls of fruit around all day long. I said, you can't. I said, they need a time where the body actually has an opportunity for the saliva to remineralize the teeth. I said, so you kind of have to stop it and put a clock on her for 2 hours and wait, or let them brush after they've had a bite to eat. So for those things that are super acidic, kind of like lemon juice and some of the other fruits out there, I ask my patients to rinse their mouth afterwards. I don't want them to brush right away because you've etched the enamel and you're brushing off the dentin, you're brushing off the enamel at that point. So you want to just rinse really thoroughly and wait at least half an hour before you're going to brush your teeth if you're going to floss and brush and irrigate your teeth again. But it takes about 2 hours for the body for the saliva to remineralize that area. So for people some people have terrible dry mouth, and it happens from the medications people are taking. There's, high blood pressure medications, antidepressants cause dry mouth. It will cause rampant decay. It is so severe, it's terrible. Some people will go on, so there are things like xylitol, which is the reverse image of sugar, and it's in some of the products for dry mouth like Biotene. It's in toothpastes, it's in mouth rinses, it's in some of the gums and in some of the mints. And so people say, well, I'm using xylitol. And I'm like, how often are you using it? How many times a day? Oh, just once a day on my toothpaste. The studies show, so the xylitol is a reverse image of sugar. The bacteria can't use it to cause decay. However, the studies indicate that you need to use it 5 times a day. That's a lot. And so some people will do that and some people can't. And how do you do it 5 times a day? That's one of the things. So xylitol is one of those products that people are happy to use. And there's nasal sprays that use it for sinuses. There are mouth rinses now out there with them. And it's part of the reason is the reverse image. And so the bacteria can't use it, can't adhere well to any of the surfaces that it's used on. So xylitol is sometimes helpful for some people. But just waiting in between meals is part of what has to happen. And with all of us stuck in the houses nowadays, and it's really, everybody just eats all day long. Because what else are you going to do?
Yeah. Wow. Well, this has been a wealth of information you've shared with us today. Super important.
The other thing?
Please. Don't stop.
So the other thing that the quarantine has done is, and the anxiety of everything that's going on right now, everybody is clenching and grinding. So TMJ is the joint that's here, opens and closes, held onto our face by a muscles, groups of muscles. I have had so many patients come in with fractured teeth, clenching, headaches. So just so you know, just so people understand, if you're waking up in the morning with a headache, you're clenching and grinding at night. A night guard makes a world of difference for people. World of difference for people.
Do they need to be prescription night guards, or can someone just go out and buy a night guard?
Some people do fine with the ones over the counter. Some people do fine with the ones on Amazon. There's some for like $100 and they'll actually send you impression material. Some of them are fabulous. You have to be careful. So if you make yourself a night guard, because most of them you have to make yourself. They come in there, you have to heat them up and you mold them to your upper teeth, and they just go on one arch, usually upper arch, so that instead of engaging the teeth like this and causing all of this muscle spasms, they slide across, and it gives your joint less of a torquing motion to it. It also keeps teeth from cracking and breaking. It makes a huge difference for people. And so if you're looking at your night guard after you've made it and you're grinding on it like this and you see it going like this, it's not doing you much good. So it depends on the mouth. It depends on the person. Plenty of people do fine with the over-the-counter one. I have one patient, he gags so badly. He says, I tried 5 of them. He says, I can't even get him in my mouth for 2 seconds. He said, it's just not happening for me. And so he has issues, but there's nothing he can do about it now. So it can cause, so if you have sensitivity in your teeth, let's say that's here and it's here and you're here, usually it's grinding and clenching if there's pain all over the place. It's usually grinding and clenching. If you're having severe sensitivity, it's usually a lot of fruit and acid. But the grinding and clenching and the headaches are tremendous right now. And so it's headaches that wake up in the morning. It's sometimes it's ear pain, sometimes it's eye pain. People head to the ENT and find out that they don't have anything wrong. It is really that. So this is my dog.
Hi. So cute. Who's that?
This is Lulu, and she has great teeth. And she just climbed into my lap because she's been really good all this time.
Does Lulu floss, brush, and irrigate?
Of course. You kidding? I'm lucky if I can get my finger in her mouth.
Does she? Yeah. Is there any kind of treats or anything that you give her specifically for her teeth?
No, I give her everything, but she's very sensitive, so I have to be careful. But she does okay.
Fantastic. Well, I think we've covered most of the topics
I think we've done really, really well.
Oh, well, thank you so much, Fredda. It's been an absolute joy to have this time together. From everyone here at Heart and Mind Traditional Medicine, we are Traditional Healing. We're so grateful for what you've shared with us today, and this will go on to help many people.
I'm happy to help, and I know I'm there for lots of you. I've been there. It's a wonderful place, and I'm very grateful to be a part of your community.
We are so grateful to have you part of that community. Thank you. Have a wonderful day.
You too. Say bye-bye.
Bye-bye.
Let's go.